Welcome, everybody. As we're waiting for everyone to filter into the room, please feel free to introduce yourselves, where you're from in the chat. We'll get started shortly. All right, let's get started. Welcome, everyone, and thank you so much for joining us this afternoon. Today marks the launch of Aligning Health and Safety, a new state policy tool that helps state leaders from all three branches of government establish strong foundations needed to advance local systems improvements at the intersection of criminal justice and behavioral health. My name is Katie Holohan. I'm a senior policy analyst in the Behavioral Health Division at the Council of State Governments Justice Center, and I'll be moderating the webinar this afternoon. Next slide. So our plans for the day, today we're going to be introducing you to this new tool and seeding some ideas about how it could best be put to use. So first, I'll provide a brief overview of the Justice Center and of BJA. Then Ruby Kazelbush, Deputy Director for Policy at the U.S. Department of Justice, Bureau of Justice Assistance, will set the stage and share more about BJA's vision for this work. Next, we'll provide an overview of aligning health and safety. And then we're honored to have state leaders from Texas and Illinois with us today to share the work they've done to reduce overrepresentation of people with behavioral health needs in local criminal justice systems. Then we'll take you on a quick virtual tour of the tool. And finally, we'll have time at the end for discussion. So we ask that you please drop any questions that come up for you throughout our conversation today in the Q&A box, and we'll lift them up for our panel at the end of the session at the Q&A. Next slide. Aligning Health and Safety is a new state policy initiative supported by the U.S. Department of Justice Bureau of Justice Assistance, a division of the Office of Justice Programs. Through its divisions listed here, OJP provides grant funding, training, research, and statistics to the criminal justice community. Next slide. BJA's mission is to provide leadership and services in grant administration and criminal justice policy development to support state, local, and tribal justice strategies to achieve safer communities. BJA works with communities, governments, and nonprofit organizations to reduce crime, recidivism, and unnecessary confinement and promote a safe and fair criminal justice system. Director Carlton Moore leads BJA's programmatic and policy efforts on providing resources and training and technical assistance to law enforcement, courts, corrections, treatment, reentry, justice information sharing, and community-based partners to address criminal justice challenges nationwide. Next slide. The four main goals and activities of BJA are to fund, invest diverse funding streams to accomplish goals, educate, research, develop, and deliver what works, equip, create tools and products to build capacity and improve outcomes, partner to consult, connect, and convene. And this tool is an example of all four of these goals. We're excited to share more. So next slide. Before getting into the content of today's session, I wanted to provide a brief overview of the Justice Center for those of you who haven't had a chance to meet us before. The Council of State Governments Justice Center is a national, nonpartisan nonprofit that works with state and local leaders across the country to improve their justice system processes. Next slide. We do this by bringing people together, driving the field forward with original research, building momentum for policy change, and providing expert assistance. Next slide. Our goals are to break the cycle of incarceration, advance health, opportunity, and equity, and use data to improve safety and justice. And in the Behavioral Health Division, we focus specifically on improving outcomes for people experiencing behavioral health conditions, substance use disorders, homelessness, and poverty across all touch points in the justice, behavioral health, crisis response, and reentry systems. Next slide. And an equity lens is central to how we advance these goals. Next slide. This project is supported by the Justice and Mental Health Collaboration Program. JMHCP promotes innovative cross-system collaboration and provides grants directly to states, local governments, and federally recognized Indian tribes. It is designed to improve responses to people with mental health conditions and substance use disorders who are involved in the criminal justice system. I want to flag for participants of this webinar that the FY24 JMHCP solicitations are currently open. They've been an excellent way for states and localities to initiate or advance cross-system efforts. And we'll hear an example from Illinois, who has leveraged JMHCP funding to advance their work shortly. And we've got a link here in the chat to the solicitation. There's still plenty of time to get your applications in. All right, so now I'm excited to introduce you all to Ruby Kazelbash. Ruby is the Deputy Director of Policy at the Bureau of Justice Assistance within DOJ's Office of Justice Programs. As Deputy Director, Ruby leads a team of criminal justice experts in developing and implementing programs that meet the challenges facing today's criminal justice systems, leaders, and practitioners. For the past 12 years at BJA, Ruby has directed policy and programs to support the criminal justice field, to develop community-based alternatives for people with substance use and mental health disorders, and to improve programming, conditions of confinement, and sexual safety in the nation's jails and prisons. Ruby has been with DOJ for 20 years, with previous experience at the Office of Juvenile Justice and Delinquency Prevention, Arlington County, Virginia, and the New York City Mayor's Office on Criminal Justice. All right, take it away,
Thanks,
Ruby.
Kate. Thank you so much. And welcome, everyone. We are absolutely thrilled to have you with us as we launch what we are hopeful and hopefully confident is going to be a really important new resource for you and your teams. We've been at this collectively, you, me, us, for many years, and we know that we've still got some challenges, particularly at the local level. While I'm excited about this is because it articulates, I think, for one of the first times in a really important and clear way, what are the policy levers that we can push and pull, that you can push and pull or advocate or push or pull at the state level to help make change more possible at the local level. At the local level, we know that we've got over 10 million people that are cycling through jail annually. And well over half of those 10 million folks who are experiencing those 10 million admissions have a mental illness, have a substance use disorder, or both. And we know that accessing treatment is going to be really key to getting those folks into recovery, and to stop the revolving door and to reduce recidivism. And we also know that local justice systems really struggle to get that connection to care right and down and make sure that it's institutionalized and more likely to happen. No matter where I go, no matter where my colleagues go, here from the Bureau of Justice Assistance, all across the country in red states and blue states, we are hearing resoundingly from legislators, from behavioral health directors, sheriffs, jail administrators, police chiefs, people leading housing efforts, advocates, that they want to know what they can do to help and how do we do better. A lot of those state and local leaders are looking for opportunities to launch statewide initiatives to break those cycles of incarceration, of hospitalization, of homelessness, particularly for people with behavioral health needs, because we know those folks are disproportionately represented within our jail population and moving down the line and also in our prison populations. I can tell you that on the judiciary side, 37 states and territories are working to implement priorities that were identified at regional summits. And this is brand new, fresh work. These summits have just occurred in the last 2 years that were held in response to the National Judicial Task Force to examine state courts' response to mental illness. And I can say that really in years of supporting community efforts through the Bureau of Justice Assistance and the Justice and Mental Health Collaboration Program that Katie referenced, we've been helping communities get funding. It's an interesting funding stream because we cannot fund one without the other. It's got to be a demonstrated partnership between a criminal justice agency and a mental health authority. And in administering that program and working with communities around the country, there's a couple of key lessons that we've learned. So one is that keeping people with behavioral health needs, when appropriate and when okay for public safety, out of the system in the first place, and to identify that opportunity as early as possible absolutely yields the best outcomes and the best use of local resources. Next, we know that not one agency or system alone can solve this problem. It's got to be public health and public safety working together. We've got to figure out ways and align ways to bring our funding together, to train our staff together, and to align priorities. We also know that local problems need locally informed solutions, that we can come up with some basic guidelines and principles and ideas and show where the evidence is clear that if we do things in this manner and with fidelity, that we'll get a better outcome for people and systems. But there's always going to be a need for customization and flexibility because every community is different. The resource level is different. And then finally, and why we're here today, is that states are central to accelerating progress at the local level and really enabling that shift from what we're able to fund through a Justice and Mental Health Collaboration Program grant, which is a program. It's a program that's serving a set defined number of people. It's seeding an idea and practice. Where we need to get to for systems transformation is how do we take a program and build policies around it, funding streams around it, staffing around it, so that we can really reach capacity in communities around the country. And that's really where this opportunity and this set of tools comes in. It is the result and the synthesis of literally decades of work in this space and really understanding that if we're going to make this change and transformation at the local level, what is it that states can do? State leaders, legislatures, judiciaries, executive branches, to make that more likely. How do you align policy and practice at the state level, whether that's a definition of a word or what goes into a state Medicaid plan that can really make that change more likely to happen at the local level. So we're really excited about this collection of information and resources, and you're going to hear from some amazing folks that are already doing this work within 2 states in the country. So with that, I'm going to turn it back to you, Katie, and just welcome everyone again. We're so happy that you showed up to join us today.
Thank you, Ruby. So now I'll hand it off to Hallie Fader-Tao, Interim Director of Behavioral Health at the CSG Justice Center, to speak a little bit more to the vision for aligning health and safety and provide a little history of how we got here. Hallie.
Hi, good morning, everybody. Thank you so much. It's a pleasure to be here representing our behavioral health team and our pleasure of working with the Justice and Mental Health Collaboration Program grantees. And I'll just draw your attention again to the solicitation link in the chat. But just building on what Ruby has said, the Justice and Mental Health Collaboration Program provides the training and technical assistance for federal grantees, but it also, part of our mission as TA providers is to develop resources that advance the field generally. And we have worked as a TA provider with many states around the country intensively, whether it's through the Justice Reinvestment Initiative, through contracts with states. We've just finished some work on familiar faces, and we've seen a lot about what it takes to bring together these state level partnerships to move policy forward. But we've done that really in a relatively intensive way, where our team is staffing, helping with data analysis, convening groups, facilitating groups. And the mandate here was to develop a resource that crystallized what we learned from that intensive work into something that would be available widely, for free, accessibly across the country, so that as individual stakeholders, either at the local level or at the state level, are taking on criminal justice behavioral health policy work, there would be a way for them to learn from those who've gone before and just avoid reinventing the wheel, stand on the shoulders, pick your metaphor. But the idea is we wanted to distill what's been happening and put it in the hands of folks like you all here and others who are accessing this tool to jumpstart the work that you are doing in your own communities. I think I can go to the next slide. This has been sort of through a process. There are a couple of highlights on the slide here, including a meeting where one of our visuals for this meeting was a picture of a folder we think it was a real folder that a county leader had, and the folder was called Unfunded State Mandates. And this dynamic that for local leaders, there's just a sense that things happen at the state level and then are thrust on them as unfunded mandates. And the vision for this work is to build robust collaborations between local stakeholders and state policymakers so that those state policymakers are advancing policies with a solid understanding of what's happening locally so that that can be scaled up or barriers can be removed. So you'll see that as a theme throughout this resource and through the presentations from Illinois and Texas today. I think one of the other things that you'll see as a theme is really the importance of aligning health and safety. In doing work in one state, we were talking with a group of county stakeholders, what would make this project a win for you? And one of the county criminal justice coordinators said, I just want state policymakers to understand that criminal justice issues and health issues are intertwined and that they have to be looked at together in policymaking. And I think that's another really important theme in this tool and in the presentations you're going to hear. Katie, I got the next slide too, right?
No, that's off to me. Yeah.
Okay, so just before I turn it right over to Katie, so the process for developing this resource was really to mine our own understanding, to talk with different policymakers about what led to success in their initiatives, and to do a lot of research and user testing with the intended users, the people who, as Ruby was saying, the people who are working on Chief Justice-led task forces, the people who, are working in in a legislative committee on criminal justice or public health, the people who are told, hey, we need to do a task force. How should we do that? And what we started with, what we're introducing today, is these 3 basic modules that Katie is going to talk about on collaboration, data collection and information sharing, and funding. And I know that when you see collaboration as a key area in the Justice and Mental Health Collaboration Program, it's not earth-shattering. However, this is truly someplace where the devil is in the details in how these task forces are constructed and what their mandates are. And so I encourage you to see the titles as what they are, which are foundational building blocks that showed up in all of our conversations about what was necessary for success, and as recipes of really concrete strategies that have worked in different states around the country. So we're very excited about this. We hope that you will be too. And I'll turn it over to Katie.
Thanks, Hallie. Well said. So as Hallie mentioned, what we've developed here is a tool, the first phase of a tool where the core content focuses on what we refer to as the building blocks for state action: collaboration, data collection, information sharing, and funding. And no matter the point of entry or group of stakeholders we talk to, state, local, executive, judiciary, state agencies, community-based partners, people with lived experience, we hear these areas come up again and again. It's this need for a mechanism to come together again and again to do the slow work of breaking down silos and developing a shared language through cross-systems collaboration. It's ensuring that both state and local leaders have the data they need to guide investments, engage impact, and whether those investments are making an impact, and if that impact is being realized equitably. And also that local health and justice partners can coordinate around shared clients, right? There's a lot the state can do to help enable that piece of data collection information sharing as well. And finally, to pinpoint opportunities to align state funding, leverage federal dollars, and ensure that funding is accessible to all communities within a state. We hear often about funding gaps to meet the need for this population. while often the silos that exist at the state and local level mean it's really hard to see what other departments are already doing on this front. And there's a need for some alignment and some coming together to understand how different state agencies and federal resources are serving a shared population. And you can see here on this pyramid there's a sneak preview of where we're headed next. In 2024, we'll be building out topical units on statewide approaches to competency to stand trial and crisis response. So we kind of have our base of the pyramid, the foundations, and then we'll get into specific issue areas with this tool in the future. Next slide. It was also very important to us that this tool was authentically 3-branch, as Hallie said. So we made sure we had the partners to match. This tool would not have been possible without the thought partnerships of the national membership and policy groups listed here, who reviewed sections of the tool, provided expert guidance on the policy levers available to their membership, gave us examples for what states that they were aware of had done to advance these goals, and connected us with people across the country leading this work, those people that were tasked with forming a task force. And this group ensured that we could deliver a tool that featured comprehensive policy actions that include not just legislation and regulatory change, but budgets, rulemaking, administrative policies, and leadership approaches. We often hear that old adage that when you're a hammer, everything looks like a nail. So our aim here was to show the wide range of policy options that state leaders and local leaders that partner with them have access to advance shared policy goals, including those outside of where they sit within the system. Next slide. So what resulted is a policy research tool for state policymakers and high-level policy staffers from all 3 branches of government, which lays out a roadmap for how states can build a strong foundation for lasting and effective cross-systems initiatives. The tool aims to help users understand the policy levers across all 3 branches of state government, learn what other strategies states have tried, gather key resources and best practices to support effective implementation, of course, because it's not just getting the policy over the finish line, but implementing it in communities, as Hallie mentioned earlier. Next slide. But before we take a spin around the tool itself, I want to recenter us around what this looks like in practice by shining a light on state leaders who have done some really creative work in this area. Next slide. So first we'll go to Texas, where we're thrilled to have 2 energetic, passionate leaders representing the executive and judicial branches here to share some points of pride in their state approaches to system improvements at the intersection of behavioral health and criminal justice. Dr. Courtney Harvey is the Mental Health Statewide Coordinator and Associate Commissioner at the Office of Mental Health Coordination at Texas Health and Human Services. Dr. Harvey built her career through service in different capacities at Nueces Center for Mental Health and Intellectual Disabilities, private care providers, and state agencies, resulting in deep knowledge and expertise in the state systems of mental health care. Christy Taylor is the Executive Director of the Texas Judicial Commission on Mental Health. She has over 25 years of experience as an attorney and policymaker. In 2017, Christy spearheaded the planning for a new Judicial Commission on Mental Health and was named Executive Director of that commission in 2018. Taylor has been nationally recognized for her groundbreaking work with the JCMH, including the development of the Eliminate the Wait campaign and the Texas Mental Health and Intellectual and Developmental Disabilities Law Bench Book. I will hand it over to Dr. Harvey to get us started.
Good afternoon, everyone. I'm so glad to be here with you all today to speak about this tool and to speak about one collaborative that we have in operation in Texas entitled the Statewide Behavioral Health Coordinating Council. So the backstory for how the Statewide Behavioral Health Coordinating Council was established is that the Texas legislature in 2013 formulated a rider that required the Texas Health and Human Services Commission to hire 1 FTE entitled a mental health statewide coordinator to coordinate across the then 18 state agencies that were receiving state funds for mental health and substance use services. It also directed that this FTE be responsible for coordinating locally with organizations who had an interest in advancing policy, services, shared funding streams to meet the needs of individuals with behavioral health conditions, as well as IDD who are justice involved. You can imagine that the hiring of one FTE in a state agency to do statewide mental health coordination went over very well with the 18 state agencies at that time who received behavioral health funding. And so I think because of the challenges that were earlier on experienced by that individual, the next legislative session, the Texas legislature established the statewide behavioral health coordinating council with the idea that the function of this group is really to come together and think strategically about behavioral health policy, how we are spending state funds and federal funds to advance behavioral health services and access to those services, as well as to reduce duplication of effort amongst the organizations. So they tasked the statewide behavioral health coordinating council with doing some core things, one of which is the fact that every 5 years we have to develop a statewide behavioral health strategic plan. Another is that we are responsible for developing what we call a coordinated expenditure report, which essentially says this is the amount of money that the Texas legislature is appropriating to all member agencies that are captured on the statewide behavioral health coordinating council. This is what is being done with those funds in terms of outcomes. And then we are also responsible for annually publishing a progress report on our collective implementation of the statewide behavioral health strategic plan, as well as publishing an inventory of programs that are funded through state funds. So what I really want to highlight in terms of the work of the Statewide Behavioral Health Coordinating Council, which I think is a unique facet, as I understand, of our work, is that coordinated expenditure report. So prior to the establishment of the Statewide Behavioral Health Coordinating Council and this requirement, during a legislative hearing, Senator Nelson at the time, she's now our Secretary of State, asked the question, how much money is being spent on behavioral health services? And at that time, there was not an individual representative of any state agency who could answer that question. We now know that Texas is spending $12 billion, that's state funds and Medicaid, on behavioral health services. $12 billion is a lot of money, y'all. And so, of course, it begs the question, what are we doing with this $12 billion? What is this collective story of how individuals are able to access services? What are the outcomes? Which is why I think this tool is going to be very critical in helping the Statewide Behavioral Health Coordinating Council advance our next phase of the work, which is telling that story about outcomes. The data piece, I think, is probably the hardest hurdle for us to overcome in terms of making data shared and making it usable, making it available to the public, and making ourselves available to help the public understand how to interpret the data that we want to make visible. So with the Statewide Behavioral Health Coordinating Council, you've got a statutory framework. We are codified in our state statute as well as through our General Appropriations Act. You also have state level infrastructure in that you have my position that again is housed at the Texas Health and Human Services Commission. And I have roughly 3 FTEs that serve as the support of the Statewide Behavioral Health Coordinating Council. When I say support, that means they are essentially the ghostwriters of work products that are published by the Statewide Behavioral Health Coordinating Council. We are statutorily required to meet at least quarterly. So those staff are responsible for the scheduling of those meetings, getting the agendas together, et cetera. And so it really is not just me serving as the chair of the Statewide Behavioral Health Coordinating Council, but it truly is a team of us that is working to make the council truly operational. So I think the Statewide Behavioral Health Coordinating Council is a key example of Policy 1 goal under collaboration, which is formalizing that statewide commitment to this kind of collaboration. And with that, I am going to turn it over to Christy Taylor to talk about the Judicial Commission on Mental Health.
Thank you, Dr. Harvey. It is truly remarkable to have a real relationship. Y'all know what I mean, where you can pick up the phone and call your colleagues over at the Health and Human Services and get answers and get a plan. So thank you so much. So I work with the judiciary, and we are probably strongest on these three building blocks in the collaboration. So we have been officially a Judicial Commission on Mental Health since 2018. The photo you're looking at is our two high courts. We have two high courts in Texas, sitting together and listening to the participants of the legal system. We brought in all the law enforcement and psychologists and psychiatrists, people with lived experience, the folks who could tell the real story of how important it was for the judiciary to join that conversation in an official capacity. So they heard about the problems that are listed that you all already know about, and they immediately decided to create the Judicial Commission on Mental Health. We are formed by court order, and what I really appreciate is that it's permanent. This wasn't intended to be a 6-week blue ribbon commission and then move on. We are staffed. So if you are starting a commission, we would love to help you out. We have advised other states as they've gotten started, but I would say you have to have staff. We've all served on those committees that you can't move the ball along when everyone gets busy doing something else. So I, like Dr. Harvey, started as the one full-time equivalent, and then we've now worked our way up to about 11 of us working on this team. So getting staff, I think, is really important. Including all three branches in that commission has helped our policy efforts tremendously. And I would say, make sure you have someone with lived experience on that commission. We have a big commission. It's 50-something commissioners because we are trying to reach all parts of our state, or at least a lot of them, and trying to be diverse in ethnicity and gender and, all the different disciplines that we need represented. So if you'll go ahead and go to the next slide. We have been able to accomplish a lot with this commission. There's so much enthusiasm, and our Chief Justice has said he's never received more calls about anything than this commission. We are actually a part of the Supreme Court staff, and that's a little bit different than some other states, but it does give us at least some, I think, of that stamp of approval from the Supreme Court, and it definitely opens doors with that Black robe effect. So from that commission, we were able to move into those local collaborations. And I think that this aligning health and safety tool will help explain what we do, because sometimes, it's hard to. And then when we are encouraging local communities to create their own collaborations, we have this tool to solidly lay out the steps in front of them. You can see at the bottom of the slide, several of our projects have been creating tools and resources, and we have quite a good mental health law structure in Texas, but some of it is little known. So we've created a new self-analysis that's a county mental health law plan, and then we go into the community. It's like a SIM mapping 2.0. We're definitely doing the SIM mapping, but we find there we're so focused on prevention, which we should be, we don't really get into the legal systems. And so we're creating like a legal system version of the SIM mapping. So I would say next on data collecting and information sharing, as Dr. Harvey said, this is definitely the most challenging portion for us. We have a few aspects. We have a communication system between our jails and our mental health providers. And we do have codified into law that some screening has to happen in the jail, and that the magistrates who are receiving people being booked in need to look for those markers and order that there be some kind of communication with our local mental health authority, and then that information be communicated throughout our trial system. So you can imagine that takes a lot of coordination, and we're still working through it, but we do have it in law, and that is helpful. We also have a pretty expansive information sharing statute in Texas. Some people are a little shy to use it because it does state that you are mandated as one of the participants in the legal system working with defendants with mental health challenges or intellectual disability to not only accept information in the continuity of their care, but to disclose information. And Dr. Harvey and I've had a lot of conversations about how it's a great statute, and people are still a little bit nervous to use it. So we work on a lot of education around that. But we do have future goals, and I think that this tool will help us with trying to create those across the board terms, how we measure things. Even just measuring our data on the judicial side is going to be quite a task because we are not a unified judiciary. So we have the view of let's get our house in order, and then we can come to the table with the information that we need. And then on aligning funding, I would say that Dr. Harvey's coordinating council really does the best work on this. What we do as our commission to expand on that is to make sure to amplify any of their announcements, any HHSC trainings on federal opportunities. I know they have webinars sometimes walking through that. We create tools that try to lower those administrative barriers. I don't know if y'all ever have, but I sat down once and tried to apply for a grant and it was hard. So I said, all right, let's create a tool that walks people through that may be starting in a county that's never done it before. And then we're just always trying to partner with other organizations. There are nonprofits in Texas and other agencies that are quite frequently asking for a letter of support for us to join in, maybe just partially fund a project. But it really is the spirit of how our commission was created. And so we try to stand to that and make sure that we're working with others to grow in the same direction. So that is, that's all our time, and I will hand it back over to Katie.
Thanks, Christy. Very exciting work happening in Texas. But let's move north now to Illinois, where the judiciary is stepping up to help knit together aligned approaches across branches, thanks in no small part to the vision of statewide behavioral health administrator Scott Block. As the administrative office of the Illinois Court's statewide behavioral health administrator, Scott serves as the Illinois judicial branch's dedicated voice and resource committed to furthering local, state, and national behavioral health and justice initiatives. In this capacity, he is the primary steward of the Illinois Court's Mental Health Action Plan, provides strategic and technical consultation for court and justice partners, and acts as a liaison to state agencies, behavioral health affiliates, and key stakeholder organizations. All right, Scott, over to you.
Great. Thank you, Katie. I appreciate that, and certainly want to thank CSG for this opportunity to share how our Illinois state courts have been implementing some really practical efforts that mirror the principles behind this aligning and safety tool. Next slide, please. So the Illinois state courts have long prioritized their response to individuals with behavioral health needs, and we've done that in various ways, including establishing a Supreme Court Special Advisory Committee for Justice and Mental Health Planning, developing problem-solving court certification standards, and providing educational seminars through our judicial college, just to name a few. But it wasn't until 2020 when the Conference of Chief Justices and Conference of State Court Administrators established the National Judicial Task Force to examine state court response to mental illness that our court really set out to address this issue from a much wider lens. As Illinois State Court Administrator assumed a leadership role in that national effort, the potential to integrate discussions and actions around addressing the impact of behavioral health disorders on all facets of the court just became really apparent. And it was also apparent that we needed a point person, and as Christy said, staff to help drive some of these issues. So with the estimated 70% of individuals involved in the criminal justice system that are living with behavioral health disorders, it's clear that courts are a significant partner and stakeholder in behavioral health systems. And it's also clear that judges are well positioned to convene and facilitate all of the different types of cross-system and intergovernmental collaboration that we're talking about. And this realization really prompted the Illinois Supreme Court to develop a judicially led statewide mental health task force, and then subsequently the role that I have the pleasure of serving in as the state court behavioral health administrator. And of course, as we've heard, all states will approach this a bit differently and choose how they do this based on anything from resources, leadership, priorities. But regardless of the what, where, and who, the one basic principle that's essential to progress in all of this is really meaningful collaboration. We throw that word around a lot, but meaningful collaboration is really important. And as you see on the slide here, Words like collaboration, cross-system, share, these are all weaved into the fabric of the CSG Aligning Health and Safety Policy tool. And they're also weaved into the Illinois Supreme Court's Mental Health Task Force goals. So when Katie and the CSG team dig deeper here in a few minutes into the policy tool, they're going to provide a brief demo, and you'll see recommendations that really support the need to formalize a statewide commitment to collaborate. And this is important, as we've all seen in many justice and behavioral health initiatives, that they're driven by a passionate or an energetic legislator, a judge, a county board chair, a mayor, what have you. But then when that person moves on, the initiative stalls or falters. So I say if we truly wish to make real progress leading to change, memorializing and institutionalizing this collaborative mindset is really what we need to do. Overall, as we know, there are very few issues that impact our community's resources, justice systems at both the state and local level, quite like behavioral health. And formalizing this type of commitment really moves us past treating these issues as a novelty and really sets the stage for intentional and focused policy considerations. The other major theme or foundational principle that you see on the slide is the collection of sharing of data and establishing priorities that drive decisions. And you've heard from Hallie, Christy, and Dr. Harvey that, and I'm sure everybody that's listening would agree, that data collection and sharing typically presents us with some of the most challenging barriers that we see on a statewide basis. For me, one of the challenges that I've always found just overwhelming is prioritizing the right data in the sea of all the information that's collected, and then really deciding what to do with that data. And an example I'd like to share of how Illinois branches of government have coalesced around a data-driven system that we found ready for change is our multi-branch effort to improve our competency to stand trial processes and procedures. So once this was identified as a systems issue, the courts and our Illinois Department of Human Services as our lead executive branch partner, we explored and shared data around the number of cases that were being subject to fitness restoration, the wait lists, the timeliness to access state-operated facilities. And when we finally had a handle on the scope and scale of this issue, the legislature stepped in and they actually passed legislation which required the development of a strategic plan that was meant to increase efficiencies and throughput activities in the state-operated hospitals. Simultaneously, the court received a grant from the State Justice Institute, which allowed us to conduct a full-scale evaluation of the court's role in competency procedures, and we developed our own plan for improvement. So, of course, you can imagine reforming a system this large and complex and aligning all these resources takes time, but to date, we have seen this collaborative effort already pay off, and it resulted in enacted legislation that essentially defaults misdemeanor defendants who have been found unfit for to community-based restoration services as opposed to state-operated facilities. And then from a funding aspect, IDHS has actually allocated funds and created a number of new pathways and contracts for courts and communities to provide access to this level of care. On a more local level, we've seen several aspirational examples in what can be done with all three branches here. So really behind building that shared vision. So next slide, please. Earlier, you heard in the presentation, Katie referenced the BJA Justice and Mental Health Collaboration Program here. In Illinois, the state court has been fortunate to receive a Justice Mental Health Collaboration Program grant award. But before that, we had to lay the groundwork, and to do so, we sought to leverage multiple funding sources from the national, state, and local level. For example, we being the AOIC, we were awarded a National State Justice Institute grant that supported the development of our court's mental health task force operations, and in conjunction and combining those funds with funds from the Justice Mental Health Collaboration Program, we developed what was adopted to be the Illinois Supreme Court's Mental Health Action Plan. And once this action plan was developed, we took a part of those Justice Mental Health Collaboration Program funds, and we supported 5 pilot programs around Illinois, and each was designated to effectuate a specific strategy from within that plan. So as these grant monies and grant terms are coming to an end, we've seen several of the pilot efforts are continuing now with braided funding approaches from state dollars, local mental health authority funds, some Justice Corp support, and even one of these programs being supported through opioid settlement funds. So to further illustrate how we formalize relationships and collaborations in that funding context, I really wanted to highlight that in my role as the state court behavioral health administrator, I've also been appointed to join our Illinois Department of Human Services SAMHSA block grant funding committee, which is really important. And I actually serve as their criminal justice subcommittee chair. So although the criminal justice subcommittee is not mandated by federal guidelines, all states that receive that federal mental health block grant funds are subject to regulations that require the state to have some type of advisory group or council. So for those court and justice professionals, I would absolutely advocate that you embed yourself and become a member of your state court's block grant committee. Next slide. So with all that, where are we headed here in Illinois? And just one final concrete example I'd like to provide is a cross-system collaboration that we have underway. And this is aimed at our state court's mandated outpatient commitment or assisted outpatient treatment statutes. And these have emerged as a shared area of interest across branches. In response, we've developed a work group, and legislation has actually been submitted in an attempt to ease some of the regulations that were identified as barriers to using this pathway to care. And although we don't have the outcome of that yet, the work group has actually approached our state Department of Human Services for funding support to continue these efforts. And the AOIC is actually leading development of a SAMHSA funding application for its current AOT grant opportunity. Big picture, the Illinois Supreme Court has also sunsetted its previous mental health task force. And this was the group that was really responsible for facilitating the relationships and activities that led up to development of our mental health action plan. And next, we're actually turning our attention to developing this framework for an ongoing convening or some type of standing advisory board of officials that are holding higher offices, those that actually have that policy level influence. We found this necessary that although our state has several behavioral health planning advisory councils and committees, and I participate on a number of these, most of those are focused on membership of made up of large community behavioral health systems and providers and trade association advocates. And more often than not, the collective focus is not specific to behavioral health and justice. So again, given this overrepresentation and prevalence of behavioral health in the courts, we really feel strongly that we need that distinction of developing a council or an advisory group and maybe inviting a few of the different stakeholders to that table. And then finally, just through these efforts, I'd like to say thanks again to CSG, because this tool came out really at the perfect time for the evolution of our work here in Illinois. As I stated, we're going to start to convene multi-branch, multidisciplinary group of policy officials and continue this exciting work to try to align policy, practice, resources, funding, and whatnot. So I appreciate the time. Thanks, Katie.
Thank you, Scott, and thank you to the rest of our esteemed panel. Again, I'll remind everyone to put any questions you have for our folks from Texas and Illinois in the Q&A, and we'll try to address as many as we can. Those we don't get to, we'll follow up with you separately after the call. So let's take a look at this thing. I'm going to share my screen for a quick walkthrough of the tool, and I'll just highlight some of the functionality pieces that are exciting and give you a sense of what we're looking at here. Okay. All right, so here's the landing page for the Aligning Health and Safety tool. You can see over here on the left, we have our 3 modules: collaboration, data collection and information sharing, and aligning funding. We hope this will grow with a few more modules later this year. So let's click into one and I can show you kind of how we've structured this. So if we go to collaboration, we'll find that there are 3 policy goals that we think are critical to strong collaboration. So formalize a statewide commitment, convene a state-local collaborative body, and then support local cross-systems collaboration efforts. If you click on one of these policy goals, let's try this one, it'll take you to 1 to 5 policy questions within that category. So does the state support the creation of local councils to advance cross-system strategic planning? Or just as we heard from Christy, and in Texas, they're doing a great work at SIM mapping. So SIM mapping is here too. Users can kind of, they might say, yeah, we do the first one, but no, we really could spend some time on the second one. So you don't have to move through the tool. You can take what you need and leave what you don't, right? Though some of these things are quite helpful to just kind of compare the best practice portions to see if the way that you're operating aligns with, what we've learned from other states around the country. So let's click into one of these policy questions. So under here, you'll see a rationale why you might want to support SIM mapping at the state level, and then ways to do it. So we have under each of these, this is where we kind of conferred with many folks across all branches to understand the different policy levers and strategies that different states have used to do it, to actualize the policy goal. And then we have things to consider. So these are going to be implementation considerations, best practices, things to keep in mind as you're working on this. And then we'll have a section down here with a diverse cross section of state examples. We tried to have each state example feature a different way of doing it, and a good variety in terms of state size, location, political orientation as well. And you can kind of click through these different states to see the options, and within you'll find links to the websites of the entities or relevant legislation. And then at the bottom we have resources. So say, I'd love to get into some SIM mapping. I want to save this for later. This is the cool functionality piece of the tool. If you click add to my resources, you may have noticed this little folder here in the corner. I've now added this whole page, this whole section to my resource folder. So when I open that up, I have this SIM mapping question, and I'm able to print and download a PDF print or download a PDF of that content. So it's nice about this. You don't have to print a whole website. You can kind of pick the pieces that you'd like to save and come back to and populate them in your folder here. So if we go into another section, data collection, information sharing. So let's look at implement universal screening and timely clinical assessment, policy goal 3. So one policy question here. Again, a rationale, ways to do it. We have legislation, incorporating screening into existing funding streams, require or incentivize accreditation, all these different ways to achieve universal screening that we've seen in different states throughout the country. And then, a list of validated tools and best practices around screening with a few state examples and resources. So again, say I want to come back to this, I'll add it to my resource folder, it populates there, and we can see that these 2 questions are still here. Now, what's kind of cool about this is that when we tested the needs of the staff that are doing this work across all 3 branches at the state level, they all reported at the end of the day, when I'm being tasked with a policy question, I have a million tabs open and I've lost track of that cool example on the NCSL's website or in this publication, and I have to kind of make sense of my very busy desktop. So our goal here was to allow people to kind of pick and choose and kind of make a neat, organized way of doing their policy research here. So also exciting, if you X out, close your computer at the end of the day, this my resources folder will be waiting for you the next time you come back to the website, and you don't need to sign in or anything like that. So the tool is live now. We'll put the link in the chat, and I encourage you all to poke around through these different sections. There's a lot here. And if there's something you're not seeing here, a state example from your state who did this in a really cool way that we don't have posted, please email us. We'd love to kind of keep this as a living document so that it grows and changes as we know this work is moving very quickly all across the country. I'll also direct you to kind of this top bar here. So program highlights will show a couple examples of how we're doing this through other kind of employing this philosophy, the strategy, using aligning health and safety in different projects at the Justice Center. And then if you go to getting started, that kind of explains like why we're focusing on collaboration, data collection, information sharing, and funding. And you'll notice down here, there's free consultation and support. The Justice and Mental Health Collaboration Program stands up through its TTA, the Center for Justice and Mental Health Partnerships, where you don't have to be a grantee. Any state can go and request free consultation, resources, and support. So we'll put a link to that in the chat too, but we encourage you all to go there if you want to connect with us to talk more about how we can actualize some of this in your states. So I will stop sharing there. And I'll add the tool to the chat so you guys can explore on your own, and we'll get into the Q&A.
Great. Thank you so much, Katie. And thank you to Courtney, Christy, Scott for sharing your experiences. You know, as you were talking, I was thinking this is the next generation of boundary spanners at the state level, people who are really tasked with creating those robust bridges across agencies and departments. So I think one question from the chat, from the Q&A, was just about the role of people with lived experience and community members, and how do you ensure that those perspectives inform the work that you're doing? So maybe I could start with the folks in Texas and then move north to Illinois.
Yeah, I can start, Hallie. That's a great question. So for the Statewide Behavioral Health Coordinating Council proper, our statute is very specific in terms of the membership composition, and that you do have to be a state agency or institution of higher education that is receiving state funds in order to serve on the body. But one of the things that I do monthly is I have a chairs meeting with the Mental Health Planning Council that the Texas Health and Human Services operates. Here it's called our Behavioral Health Advisory Committee. And so that committee has a number of individuals with lived experience. They also have a children's, youth, and behavioral health subcommittee that not only has family members with lived experience, but also is now incorporating youth with lived experience on the council. And so we really do leverage the Behavioral Health Advisory Committee, as well as other advisory committees that are operated by the Statewide Behavioral Health Coordinating Council member agencies, to inform how we better incorporate individuals with lived experience in our policy development processes, in identifying what our service gaps are, et cetera. And in fact, we have an individual with lived experience, a family member from Texas who's on right now. And so I'm seeing some messages that she's posting in the chat. She's a great stakeholder to us. And so I think for us, the next step though is really how do you meaningfully involve individuals with lived experience when you're developing policy, when you're making decisions about funding, et cetera. Really, what I hear from stakeholders is let's move beyond tokenism, and really have us at the table and really listen to our expertise and take that in your planning and rollout of services. So I think there's room for us to grow there, but it's through those kind of partnerships, individuals with lived experience coming to our quarterly meetings or monthly meetings to give us feedback is how we involve persons with lived experience.
Hallie, and I'll just add on to that from an Illinois perspective, our state has made some pretty significant investments in increasing the peer workforce. So we're pretty excited about that, and we're working closely with our Department of Human Services and some of our peer support agencies to used some of the grant funds actually that we were awarded through Justice Mental Health Collaboration Program and a recent BJ Drug Court grant, and we've implemented peer support within some of our programs. And then at a policy level, I mentioned our mental health task force. We did have lived experience at the table there, and as we start to move into our higher level policymaker advisory group, we'll certainly have advocates and peers included in that structure as well.
No, thank you both. It has been a jam-packed hour. There are many more things I would love to hear about from our panelists, including some really great questions about how you think about state policies that serve both urban and rural communities. I know that Texas is not just Dallas and Houston, and Illinois is not just Chicago. We have that in the tool, and it's something that I think we can continue to work through, and also, again, would encourage folks to use the Center for Justice and Mental Health Partnerships with additional questions. But I know it's the top of the hour. I just would like to extend our thanks and gratitude to Ruby at BJA, to Scott and Christy and Courtney for the work that you're doing in your states. And to all of you who joined us this afternoon, thank you for the work that you're doing. And we really hope that this becomes a resource that helps you do what you do. Have a wonderful afternoon. We will be sending around slides to those who registered, and it will be posted on our website in a couple of days. Thank you.